It is a healthcare secret that involves the NFL and Mother Teresa. But it has many hospital CEOs shaking in their boots. Hi, everyone. Welcome to the Healthcare Secrets Podcast. I'm John Daly, along with Judd Anglin, author of the book, The Big Book of Healthcare Secrets, that you can get on our website. And that website is healthcaresecretspodcast.com. And Judd, the secret we are talking about today is Health City Cayman Islands.
Yeah, John. As a medical tourism expert for the past 18 years, I've traveled the world and conducted site inspections at countless hospitals. And I have to say that this is hands down the most impressive hospital that I've seen yet. I first visited there back in 2014, and I was actually shocked by what I saw. I mean, not only was the hospital brand new, but it just had a sense of brightness and warmth. It was very inviting. But more importantly, I think it was the culture of the staff. From the chief cardiologist down to the custodians, they were just very warm, inviting. They made contact, genuine eye contact, and full of smiles. I believe they know that they're on a world-changing mission. But get this, Health City is only a 1-hour flight from Miami. And keep in mind, I've been helping uninsured Americans for the past 15 years travel to places like Thailand and Malaysia, which is like 24 to 28 hour flight. So not only is Health City only a few hours away from most Americans, it's also a stunning tropical island paradise. It's very relaxing and, always very warm place to visit. But a few of the other incredible benefits of Health City Cayman Islands is that it's fully JCI accredited. That's the Joint Commission, the same organizations that accredit American hospitals. Everyone there speaks English very fluently. I mean, it's a British colony. And they accept U.S. currency everywhere you go. So it's just very easy to get around. And so I just have to say, in my experience, my professional view, going to Health City for medical treatment really heals your body, mind, and soul.
And again, the Caymans is a great place to visit. Now, we did a segment on Undercover Jet Setter about the Caymans. It is, what most people don't realize, it's the culinary capital of the Caribbean. And, of course, Health City is almost the capital of medical tourism for many. Let me fill you in on that opening tease, folks. This is a good one, and Judd actually is the one that found this one. Health City Cayman Islands is a go-to facility for the NFL Alumni Association. Think about that, retired football players. And also the doctor who started it is Dr. Devi Shetty. He was Mother Teresa's cardiologist in India. Now, he was a CEO of Narayana Hospital, that's in India. But Judd, he wanted to show American hospitals how to provide state-of-the-art care at a fraction of the cost. Talk about Dr. Shetty's mission.
Yeah, Dr. Shetty is a real trailblazer, John. Really prolific and a big-time problem solver. As a cardiologist in India, he was really troubled by mothers who brought their young children in to see him with congenital heart failure. And their first question was always, how much will that cost? And he knew that it was way more than they could afford, but he also knew that those young kids would die without the surgery. So in 2000, he founded Narayana Heart Hospital in Bangalore. And I don't think he's looked back since. I think today there's 27 branches spread throughout India. And he's just on a mission to fundamentally transform the economics of healthcare so that treatment is affordable for all. And in order to do that, he thinks it has to be commoditized, which means, running the hospital at full capacity 24/7 to reduce the cost. The Wall Street Journal even refers to him as the Henry Ford of surgery. And he truly believes that to change healthcare, we need process innovation and not product innovation. And John, I think it's clearly working. Like we discussed in our last show, total heart bypass surgery in Bangalore costs $1,600 versus $110,000 at Cleveland Clinic. And that's with the same infection and mortality rate. So in the year 2014, he established Health City Cayman Islands, where he's implementing this process innovation right in our own backyard. And most of the surgical procedures there are currently, I think, around 50% of what they cost here in the U.S. He's just on a mission to show U.S. hospitals how to provide affordable health care, and I think that's really exciting.
And he has shown how to do that. When you see the difference in the pricing, it's absolutely amazing. We're going to get into that in a second. This is the Healthcare Secrets Podcast. I'm John Daly. He is Judd Anglin, the author of the book, The Big Book of Healthcare Secrets. Again, it's on our site, the healthcaresecretspodcast.com. That book will save you thousands of dollars. Now, we're talking about Health City Cayman Islands, a top spot for medical tourism. It is perfect for many Americans. We should also mention that on an upcoming podcast, we will talk to Mary Jones from Health City Cayman Islands. So make sure not to miss that. So, Judd, you being the expert in the U.S. on medical tourism with your company Med Retreat, when did Health City actually hit on your radar? Was it around 2014 or was it earlier?
Yeah, it was a bit earlier. I believe it was late 2012. Mm-hmm. Basically a case study in the Harvard Business Review. This is where I first learned about, healthcare economic transformation model that Dr. Shetty envisioned. But what really got my attention was that he was transporting surgeons from India to pack up and relocate to the Grand Cayman Islands. And these doctors were the top in their fields. They essentially gave up their high society status in India to follow Dr. Shetty to this far-off Caribbean island. I mean, they obviously believe in his vision and mission.
Talk also about the fact that these doctors, they just specialize in one type of surgery. So that's what they do all the time.
Yeah, John, that's right. That's a good point. Just like an assembly line in a factory, high volume. That's part of the strategy. Heart surgeons conducting surgery day in and day out, for example. We all know the saying, surgery is an art and a science. So when you do thousands of procedures versus hundreds, your art is certainly going to be top rate.
I was there really as a journalist and a TV news producer. You were there on behalf of patients, so you actually saw things in a little different way than I would. But I got to tell you, I was blown away because I saw it was all about patients and procedures, and it's not like all the other hospitals that are mausoleums to art collecting. This was pristine and clean. Talk about how they use the facility to create oxygen in case there's a power outage.
Yeah, that's pretty amazing, isn't it? When they were giving me a tour of the hospital, they emphasized the planning and strategical thinking that went into their construction. I'm talking about planning for every contingency possible to best ensure the safety of their patients. They really left nothing to chance there. And to your point, they even generate their own oxygen in-house so they don't have to outsource it from anywhere else. It's pretty incredible.
Yep. And talk also about the pricing. Again, we're going to talk to Mary Jones, and we'll get into some of that with her, I'm sure. But to me, what I was amazed at was that a hip or knee replacement in the U.S. on the mainland is going to be anywhere between $40,000 and $50,000. At the Cayman Islands, it's under $15,000 or $20,000.
Yeah, that's right, John. About $15,000 to $20,000. But I know that Dr. Shetty's on a mission to continually to reduce that.
Okay, and talk too, because people are going to say, oh, wait a minute, I'm going all the way there. How do I know it's going to be safe? Their credentials are impeccable. Talk about that.
Yeah, that's a great question, John. And I always say that medical tourism is not right for everyone. So the first step is you have to determine if it's right for you. But consider the fact that it's JCI accredited. So it has, by world standards, just very high accreditation, highly trained and skilled doctors that's done thousands of procedures. And it's very close to the U.S. But here's something else I tell people to think about is that the last thing any foreign hospital that takes medical tourists, the last thing they want is some kind of error or gross negligence on their part. Because that could certainly end up headline news the next day around the world. And that would be detrimental to their business. So you definitely have to consider those factors.
Wow. And they're growing too. I mean, they're actually adding more facilities there. It is going to be a health city.
Yeah, it sure is. They have a mission for massive expansion over the next several decades, I believe. And they started out with cardiac and orthopedic procedures, and they're adding new specialties every year. And I know Mary will get more, provide more detail into that. So stay tuned.
Mm-hmm. And just one other plug for whether you're going there for medical tourism or you're going there for a vacation, or a lot of Americans are going to move there at some point. And I was so impressed with the area. It's even though it's a Caribbean island, it's actually a very modern island. It reminded me of a modern Cape Cod, except a little bit warmer, obviously. And I was explaining it to my wife. I was showing her all the video we'd shot and the segments we'd done, and she's like, "We're moving there." So at some point, she wants to go there. And she would like to, because she knows there's going to be great healthcare nearby. So talk about that. Talk about what it could be a great spot just for somebody just to go visit.
Yeah, that's a great comparison, John. A modern Cape Cod. I actually thought the same thing. When I was there, I loved it. I mean, it was very relaxing. I rented a bike and rode along the beaches and explored a bit, and just a really fantastic destination. Of course, all the people I met were so friendly, warm, and full of smiles, and I just felt very relaxed and really enjoyed my time there.
All right, so let's remind folks. Mary Jones from Health City Cayman Islands will be joining us here on an upcoming show. You and I, we've both spent a lot of time with her, and she knows her stuff. Yeah,
absolutely. Mary's great. She's the director of U.S. region, and she attends all the big healthcare and insurance conferences here in the U.S. And she's talked to hundreds of CEOs, benefit managers across the country, and she has a wealth of information. Her energy and enthusiasm is off the charts, so I always enjoy talking to her. And I think she's going to just be an awesome guest for our show. I look forward to hearing it.
Definitely. And if you're interested in using Health City Cayman Islands, you can contact Judd. And what's the best way for them to get in touch with you? Through the MedRetreat site?
Yes, that's right. It's medretreat.com. So you go to our homepage, you're going to see Getting Started in 3 Easy Steps. So click on step number 3, and that's our online application. Fill that out, and then in the prompt where it asks how you heard about us, just type in podcast on Health City. And that way we can, when we make contact, we know that you know the basics, and we'll get right into what you're looking for.
All right, cool. All right. Well, folks, keep listening. And again, this is the Healthcare Secrets Podcast. Check out our website, healthcaresecretspodcast.com. You can get Judd's book, The Big Book of Healthcare Secrets. That will save you thousands of dollars. We're also on Facebook, YouTube, and Twitter. On Twitter, our handle is Healthcare SEC and the number 1. So, folks, stay healthy. Remember, only you can do it. And Judd, looking forward to talking next time with Mary.